So, my topic, as you can see there, has to do with the medical profession and wisdom and ethics. I'd just like to begin by giving two slides of the landscape, shall we say. So the first is to say that medical practice is full of many things, and one can think about various domains such as biology, technology, autonomy of the patient, dignity, fairness, mortality, all sorts of, shall we say, big picture things. There's a need for practical wisdom in the midst of all this, and so we want to be able to assess the value of different ends and determine the best means to achieve them in particular circumstances. And also, in doing so, navigate between and actually attempt to integrate competing ethical claims. And so now the landscape of medical ethics. To put things on the more simple side, those of us who teach ethics in medical contexts, by and large, we focus on three different sort of theories of normative value. There's the deontological principles that focus on right acting or right actions, and then there's consequentialism that looks at outcomes or good states of affairs. And then there's virtue ethics that focuses really on the agent or the morally good person, and that actually tends to be remarkably underemphasized. So my objective in the project for this grant opportunity is to develop a conceptual framework of practical wisdom for the medical professional that integrates contemporary approaches to medical ethical reasoning, the professional's conscience, and the professional's obligations to society. So as you can see, not a small task, right? And the form this is to take is a 7-chapter manuscript intended for publication as a book. This little schematic here is a key part of the way I think about all that I'm saying here today, is that on the one hand, we think we understand things like diagnosis and prognosis. On the other hand, we have things we can do. We may or may not do actions, interventions, but then we have goals that we ought to be striving for. I would suggest that in medicine, by and large, we spend relatively little time, curiously enough, talking about goals. We're very good at wondering, shall we put in the pacemaker or not? Shall we transfer to the ICU or not? We're doers, we're actors, we're interveners. We're also, on average, pretty good about diagnosis and prognosis, right, given our medical science. But the point here is to say that the goals really need to come into the fore in terms of our understanding, realizing there are connections, there's some two-way traffic in that schematic. Now, I also agree with the likes of Alistair McIntyre and his notion of the idea of a moral practice, but also a moral community that is the group of people that practices these internal goods that are at stake. And he also very artfully writes about, as those of you who know his work, how the internal goods for a practice to be moral have to be realized, and then the virtues are necessary as means to accomplish those ends. And there are also means that the virtues are necessary to resist the external pressures. McIntyre writes in After Virtue very perceptively about how a profession or a moral practice actually needs the institution that sustains it financially, politically, etc. And yet there's a constant tension between the two because the politics and the money needs so easily overwhelm the moral practice that needs to be sustained. And especially right now, given the economic downturn, hospitals everywhere are greatly struggling with this, and there are clinicians who have been willing to lose their jobs because they say, no, our mission cannot do what you're asking us to do. So either I stay and do what I believe I'm here to do, or something else has to happen and I may have to leave. So the virtues are necessary for that sustenance.